Honorable Roosevelt Skerrit, Prime Minister of Dominica, Honorable Senator Ann Peters, Minister of Health of Grenada, and President of the 28th Pan American Sanitary Conference, Honorable Nils Dulaire, Mr. Albert Ramdin, Assistant Secretary General of the Organization of American States, representative of Dr. Margaret Chan, WHO, my dear Dr. Myrta Roses, distinguished ministers of health of the Americas, distinguished ministers of health participating via the internet, Honorable Esther Brimmer, Assistant Secretary General for State International Organizations, distinguished guests, ladies and gentlemen, and staff of the Pan American Health Organization, both in headquarters, but also those who are viewing over the internet. Let me say good morning, buenos dias, bom dia, bonjour. Truly, I am humbled, but yet I feel very honored and privileged with the oath of office that I have just taken, and moreover with the trust which has been bestowed upon me. Let me begin by thanking the member states of PAHO and the WHO Executive Board for granting me this opportunity to move forward the mandate of this great organization. This mandate is proclaimed in the first chapter of our Constitution, and I quote, "To promote and coordinate efforts of the countries of the Western Hemisphere to combat disease, lengthen life, and promote the physical and mental health of the people." That mission remains as important and relevant today as when it was first conceived. It has been advanced by the directors who have preceded me, and two of them are here, Sir George Allen and Dr. Myrta Roses. I want at this time to join many others in thanking Dr. Roses for her fine stewardship as director and nearly 3 decades of service in public health. Congratulations. Distinguished guests, we face both challenges and opportunities today across the Americas. Ours is a region experiencing sustained economic growth and improved governance. Incomes are rising and middle-class populations are growing. Member states are making progress towards realizing the Millennium Development Goals. Our hemispheric institutions, such as the Organization of American States and regional alliances such as Mercosur, UNASUR, SICA, and CARICOM, are enabling us to better coordinate policies and share best practices. We are more integrated in the global economy and with multilateral institutions. Progress has been realized across a broad range of important health indicators. Dr. Roses spoke about those in her address. Infant mortality rates have declined. More children are protected through immunization. Life expectancy continues to rise. Investments have been made in development areas that directly impact human health, such as food security, nutrition, access to safe water and sanitation. Our member states have made bolder commitments and allocated greater resources to providing access to health services to all of their populations. In addition, more people have access to information about their health and healthy living. They have more access to new technologies that educate them, as well as those that can treat and cure them. And beyond just preventing and treating health conditions, we are also beginning to address important social and environmental determinants that directly impact human health. These conditions converge to create a unique moment for health in the Americas. We have a powerful potential for health to be a driving force for change. Nevertheless, our progress has not been experienced equally, and new challenges are emerging. For example, our demographics are changing, so even as we work to provide care so that every child and young adult can have the chance for a healthy, productive life, we also need to care for a larger and growing population of older adults. We must address the large and growing burden of non-communicable diseases. This includes cancer, diabetes, heart disease, and chronic respiratory illnesses. These are no longer just diseases of the rich. They constitute the leading causes of premature death and disability across our region. They also cause disproportionate suffering among lower income groups and contribute to the rising health cost. We also cannot ignore the quiet killers such as obesity, physical inactivity, tobacco consumption, and the harmful use of alcohol. These can be effectively reduced and treatment improved through utilizing the WHO Best Buys intervention. Public policies can help shape the way we live, work, and play, creating environments for healthier life choices. Investing in these interventions and mobilizing political support for their implementation will help people live longer and healthier. In addition, certain social and environmental determinants, factors such as where people live, where they are born, where they work, and where they age, also lead to health inequities. Many across the Americas have benefited from the region's sustained economic growth and rising income. But not all individuals, communities, and countries have progressed evenly. Poverty levels have declined, yes, over the past 3 decades, but today, there are still more than 150 million people in our region living in poverty. And more than half of those are living in extreme poverty. And this is the reality of our region. We must therefore continue to work to extend the benefits and possibilities of health throughout the Americas and in each of our countries. This means focusing our special attention on the most vulnerable and marginalized people, especially the poor. While their needs are greatest, their voices often go unheard. We must also overcome the barriers of health access for the indigenous communities, ethnic minorities, people with disabilities, women and children, older adults, among others. Investing in their health and well-being is critical to alleviating poverty and empowering all people to realize their fullest potential, contributing to their families, communities, and societies, and indeed to our region's collective future. In our technical cooperation efforts, we will continue to prioritize action in the countries with greatest needs. We recently marked the 3rd anniversary of the tragic earthquake that devastated the Haitian nation and the Haitian people. We will renew our commitment to working with the Haitian government and people, building capacity, and working with other partners to rebuild the country's health architecture and infrastructure. For me, of the many challenges that this organization and our member states face, one goal stands atop of all others. It is providing universal access to health care across the Americas. This is my passion and this is my mission. For indeed, good health is rooted in equity, universality, solidarity, and inclusiveness. No other single achievement in health would contribute more to ensuring a long, dignified, and productive life. In my professional career, I am most proud of assisting my home country of Dominica achieve universal access to health. This experience has shaped much of my thinking, and it drives much of the passion and energy that I have for public service. There is no single or sure path towards such an achievement. Our member states are indeed diverse in size, resources, and levels of development. But I do believe there is common ground among us in at least 3 fundamental tenets of universal health coverage. First, it means that every individual and community has access to health services for prevention, promotion, treatment, and rehabilitation. Second, it means putting in place the financial mechanisms and policies that must ensure that people are protected from falling into poverty when they access health services. And third, universal health care means universal access to well-trained, motivated, well-distributed healthcare professionals, to safe, quality, and effective medical products and technologies, to well-organized delivery networks. In effect, it means building and maintaining strong health systems based on the primary healthcare approach. Our work in this must be guided by innovation, evidence-based information, and the appropriate research. As we today reaffirm the ongoing mandate of this organization, I know from a long career in clinical and public health that health systems must continually evolve to meet the needs of a changing world, to both tackle emerging challenges and threats, as well as to embrace new opportunities for reform and progress. Every one of you here, everyone listening to us on the internet, each of us has a stake in this success, be it governments, civil societies, district and local authorities, communities, the private sector, academia. So I wish today to exhort all of us to contribute the political will and the resources necessary to achieve universal health access. As director, I will champion this goal. I will work to enhance the organization's ability to work side by side with our member states to develop health systems and services and promote models of care which advance universal access. The Americas has a long history of success in addressing communicable diseases. We have successfully taken on smallpox, polio, measles, and rubella. Our work continues today in global priority diseases, such as HIV/AIDS, tuberculosis, and malaria. We are also scaling up the fight against Chagas, dengue, onchocerciasis, and other neglected infectious diseases. We cannot choose between or among those diseases. Instead, We must make space in the regional agenda to combat all diseases that can impact mortality and reduce our quality of life. We will need to develop and implement multi-sectoral approaches to address the complex determinants of these diseases. We must also work to improve alert and response mechanisms for extreme environmental events, natural disasters, and disease threats and epidemics. In this regard, I want to appeal to member states to accelerate action for ensuring that they meet the core capacities under the international health regulations. I believe in promoting change in health. Cambio and salute. It defines this organization's primary role and its core value. But I also believe in health for change. Salud para el cambio. Improved health will, no doubt, translate into stronger economies, more cohesive societies, and in nations better able to integrate and compete in the global world. If this organization is to respond to the mandate given us by ministers of health of our member states, then we, the Secretariat, must become a healthier body. This begins with my working immediately to celebrate and empower everyone in this organization to become more effective technical experts and better global health diplomats. We will explore innovative strategies and flexible cooperation models to improve regional and national health capacities and ensure that all countries benefit from each other's advances and expertise. No individual, no institution, and no member state has all the knowledge, resources, or capability to do this alone. We need to seek and develop new partnerships to leverage the best ideas, share the most important knowledge, and adopt the most innovative approaches and practices. This may include our working with multilateral agencies, development banks, civil society, think tanks, academia, faith-based organizations, professional associations, and the private sector. Ours must be an inclusive, shared agenda with collaborative partnerships that promote the development of national, regional, and cross-regional health architecture. I believe strongly in the whole concept of country ownership. But this must be more than just a popular theme that is discussed in international and global fora. If we are to make it a reality in the Americas, then all stakeholders must have a seat at the tables where local and national health decisions are made. And all stakeholders must commit to the behavior change that will allow them to align and harmonize around national leadership. I wish today to invite everyone to participate in expanding this organization's global health diplomacy. We should also search for solutions beyond our hemisphere to learn from Europe, Asia, and Africa, as well as to offer them our own experiences. Our relationship with the World Health Organization will enable us to share knowledge and resources and align our goals and accountability. As WHO undergoes its reform process, we must ensure a strong connection with our headquarters through a commonality of goals and the sharing of global public health goods and resources. Even as we advance our own agenda for the Americas, we can also help shape global health diplomacy. We are blessed today with new tools and technologies to help us listen, share, and communicate. Let's together explore new partnerships to use these evolving technologies such as the social media and e-health to engage with our stakeholders and constituents and to advance healthcare. Finally, I would like to say a few words to the men and women of the Secretariat of the Pan American Health Organization. As we embark on this journey together, you should be proud of this organization's long-standing commitment to improving health. You are heroes and heroines advancing health reforms and health progress. I look forward to hearing from each of you how together we can go further, faster, and smarter. Your commitment, your energy, and your determination and your passion will prove to be decisive. To our member states, I pledge that we will be a responsible steward of the resources that you entrust to us. We will be accountable and transparent. We will be fiscally responsible, and we will be results-driven. And every day, we will demonstrate our value in meeting the health priorities of our people. The Americas are united by a shared history and geography. We are blessed with great natural resources and a wealth of human capital. And we have a health agenda for the Americas that is ambitious yet achievable. With the transformational changes underway across our region, this is a moment for unity of vision and of recommitment to our mission. I ask this of all of you, and I ask for your prayers as I undertake my responsibility today as director. And in that respect, I want to thank the many people who have prayed for me, my family, my friends, even people I did not know as I undertook this journey. Let me close with a remembrance from my childhood. I grew up in a village, and because I was so close to the community, I have many memories that continue to influence who I am today and what I bring to my work. As a little child of 5 years old, there was this lady called Mazi. My mother will remember Mazi. Mazi lived in our neighborhood, and Mazi had 4 or 5 children. Even to a 5-year-old, I realized Mazi was very pregnant. And one day, Mazi stood with her little suitcase in her hand, and my old grand aunt wished her safe passage. And I didn't understand, where could Mazi be going and leaving her 4 or 5 children? So I asked my grand aunt, what does that mean? And she said, many times when people go to have a baby, they don't come back. And I began, why would Mazi not want to come back to her children? And my little mind could not understand it. Today I understand it quite well. Giving birth can be one of the most joyous events in a woman's life, but it can also be one of the most dangerous. Every day, women around the world die from preventable causes related to pregnancy and childbirth. I don't know about you, but I know that we cannot tolerate maternal mortality in our modern world. Every mother every mother, every child, and every family must be cared for. I believe that we have the power to effect change in maternal and child health, in non-communicable diseases, in infectious diseases, in strengthening health system, and achieving universal access to care. And this is why we must all work together to meet the aspirations of our citizens for health equity, human dignity, and economic and social opportunity. I thank you so much. Good day.